What if I told you that one of the most common blood pressure medications in the world, a drug taken by over 50 million Americans alone, has a secret side? And that for nearly 1 in 4 people, it's causing subtle changes to their body that they don't even realize are connected. This isn't about the rare risks you see on a drug commercial. It's about a complete picture, a full understanding of a medication you might be taking every single day. I'm Dr. Jenny. Amlodipine has been a go-to for high blood pressure for decades. But with so many people relying on it, we have to look deeper. We need to go beyond the basics and uncover the full landscape of what this medication does inside your body, from the common to the truly unexpected. Today, we're pulling back the curtain on the side effects your doctor is praying you'll take the time to learn about. Because when it comes to your health, being informed isn't just important, it's empowering. The first sign you might not have connected to your medication is a strange new feeling of unsteadiness. Imagine you stand up from your chair and the room briefly spins, or you feel a wave of lightheadedness. That's dizziness, and it's a very common early experience with amlodipine. This often happens because the medication is doing its job, lowering your blood pressure. For your body, this is a major change, and it needs time to adjust. Fortunately, for most people, this sensation lessens over time as your system gets used to the new normal. But here's a tip that might help. Be gentle with yourself. When you go from sitting or lying down to standing, take it slow. And dehydration can make things much worse, so remember to drink plenty of water. If the dizziness persists, it could be a sign that your dosage needs to be adjusted, so make sure you bring it up with your doctor. The next side effect might be something you've literally been walking around with. Have you noticed your socks leaving a deep indentation around your ankles at the end of the day? Or maybe your shoes feel a little tighter than usual? This is likely edema, and it's one of the most frequently reported side effects of amlodipine. Here's why it happens. Amlodipine widens your blood vessels to improve blood flow and lower pressure. But this beneficial widening can put extra pressure on the tiniest vessels, causing a small amount of fluid to leak out into the surrounding tissues. This buildup of fluid is what you see as swelling, most often in the legs and ankles. What's even more interesting is that clinical studies show women are 2 to 3 times more likely to experience this side effect than men. You're sticking to your routine, but the number on the scale is going up. This might sound concerning, but it's not because amlodipine is adding fat. Instead, that extra weight is almost always caused by the fluid retention we just discussed. For most people, this fluid-related weight gain is manageable. But if you have a history of heart failure, this is a key sign to watch for. A rapid increase in weight could signal that your heart isn't pumping as efficiently as it should be, leading to a dangerous buildup of fluid throughout your body. If you notice any sudden significant weight changes, call your doctor immediately. This is not a symptom to ignore. Angioedema is a word you probably don't know, but it's a symptom you should always be aware of. While it's very rare, angioedema is a life-threatening type of swelling that can affect your face, lips, tongue, or throat. Because it can obstruct your airway, this is a medical emergency that requires immediate attention. If you experience any sudden severe swelling while taking amlodipine, especially of your face or throat, go to the emergency room right away. The next sign is a general feeling of being drained. Do you feel more tired than you used to? A general lack of energy or weariness can be a side effect of many blood pressure medications, including amlodipine. Your body is adjusting to a lower blood pressure, which can temporarily leave you feeling a bit drained. This is a side effect that is not related to the dosage and often gets better as your body fully adapts to the medication. But what if you suddenly feel hot and look red? Remember how amlodipine widens your blood vessels? This can sometimes cause a temporary rush of blood to your skin, especially on your face, neck, and chest, leaving you with a warm, flushed look. This is a direct consequence of the drug working as intended, but it can be uncomfortable. Interestingly, just like with edema, clinical trials found women were 3 times more likely to report this symptom than men. The next sign might feel like a nervous flutter in your chest. Palpitations, the sensation that your heart is pounding, fluttering, or skipping a beat, can be a surprisingly common side effect. It's an unsettling feeling, and it's another one that clinical data shows is more than twice as likely to be reported by women compared to men. While palpitations are often benign, if they're persistent or accompanied by other symptoms, they warrant a conversation with your healthcare provider. Have you felt queasy after taking your pill? Nausea and stomach discomfort are possible side effects, though they are usually mild. The good news is you can take amlodipine with or without food. If you notice a pattern of feeling sick on an empty stomach, simply taking the pill with a meal or a small snack might be all you need to do to feel better. Amlodipine is designed to lower your blood pressure, but sometimes it can lower it too much. When this happens, you might feel lightheaded, dizzy, or notice your vision is a bit blurry. The risk of this increases with higher doses, or if you're taking other medications that also affect blood pressure. More severe symptoms like a fast heartbeat, confusion, or fainting are signs of a medical emergency, and you should seek help immediately. This last sign might be the most surprising. While it's uncommon, some people report involuntary muscle shakiness or tremors. This can be unsettling and interfere with daily tasks. If you notice any new or unusual changes in your muscle control, stiffness, or tremors while on this medication, it is critical to report it to your doctor right away. Understanding your body and how it responds to medication is a form of self-care. It's about being an active participant in your health journey and knowing the right questions to ask. If any of these side effects sound familiar, talk to your doctor. They are your partner in health, and your observations are valuable information. Knowledge is power, and knowing what to look for empowers you to take control of your health. Your body has a voice, and it's telling you something. The next step is to listen. If you're concerned about memory lapses or changes in a loved one, you need to hear this. I've broken down 10 crucial, often missed early signs of dementia that are mistakenly attributed to normal aging. Click here to watch 10 early signs of dementia you should never ignore, and gain the critical awareness needed to take action.